Nope.
Mm-hmm.
Okay, my name is Nicholas Coda Ramos. This is my badge. I'm going to be doing my indwelling catheter skill. I'm using 3 separate videos: indwelling catheter, enema, and the NG tube. So this is my setup. I have my legs in my vagina, and this is you pan the room. So I have Carly recording. So yes, this is what I got going on. I got my table here, and then I have this little pocket's gonna be my trash can. So I'm gonna start. So when I start, I'm coming in and I'm gonna do my 2 identifiers and verify my hospital order and the hospital policy. So I have my identifier, Jaguar J. Jones, MR number 4176352, 4176352, and allergies, penicillin. Then I'm going to perform hand hygiene as well, and I'm also going to indicate 3 indications of needing an indwelling catheter. So if they're on bed rest for surgery or trauma, if their mental stability is declining, and if they're on palliative care or end-of-life care. So I'm going to move these out of the way. So, got my patient, and what I'm going to do is I'm going to perform hand hygiene. I did that. Or I'm going to don my goggles. I'll put them on, but I'm just going to say my glasses is my goggles because it's kind of stupid with them like this. So I've got my goggles on, and I position my trash can. This is my trash can, and then I'm performing hand hygiene. After performing hand hygiene, I'm going to raise the patient to a working level, lower any side rails, and put them in dorsal recovery position. So that's with their legs like this, but laying down. So that's how she is going to be positioned. After I do that, I'm going to go ahead and put on my clean gloves. And when I put on clean gloves, and I would perform pericare. So pericare for a vagina, you're going to use 3 either bed wipes or soap and water cloths. You're going to do the far labia, the near labia, and then straight down the middle. And then for penis, you're going to do 3 strokes with the urethra meatus in an outward position like this. 1, 2, 3. All right. After you do pericare, you're going to take off your clean gloves, and you're going to perform hand hygiene, and then you're going to start with your sterile field. So you're going to take this, you're going to open it away from you, open it away, and then you're going to take it out. My nose itches. You're going to take it out, place this down near the patient. It's kind of crusty. Then you're going to use this bag as trash. So fold it back, and I'm going to put it on the patient's leg. It's going to be my trash bag, just like that. And now I'm going to open my sterile field. So I'm going to be aware of my 1-inch borders. So I'm going to first open it away from me, just like that. Kind of try and lay it flat so it doesn't come back on itself. And then now I'm going to don my sterile gloves. Take this over here. I'm donning my sterile gloves. Open it away from me. Throw this away. Do right one. Maybe. I'm gonna take my left one. Being where my thumb and my other fingers. Take this one off. Now I'm gonna readjust. Okay. So now everything is sterile. I'm sterile, so I'm gonna take this and open it, and I'm gonna use the shiny side down, and I'm gonna put it right down between the legs, just like this. And after I do that, I'm going to take my first tray and bring it over here, come right here so you can see the vagina. Or you can come here, no, that's fine. So I got my field set up. So now what I'm going to do is I'm going to prep the rest of this. So I'm going to prep my swabs. I open it and take them out, throw this away right here. Then I'm going to prep my lube. Just gonna squirt it in here. We're not gonna use the lube. And then I'm going to, I'm going to put my sterile water in my balloon port. So when I do that, I'm gonna come over here, get my balloon port, and pop it right in here. So now what I'm gonna do is I'm gonna take my catheter tube out. It's really floppy, so just kind of be aware of it. If it falls, make sure it falls in your sterile field. Busy. And then I'm gonna throw this away. Now what I'm gonna do is I'm gonna take this over here and I'm going to lubricate my catheter. So when you're lubricating for a woman, you're gonna lubricate it 1 to 2 inches, and then for a male, you're gonna do 5 to 7. So I got it lubricated. So now what I'm going to do is I'm going to open up my vagina. So I'm gonna hold it open, and once I hold it open, I can't close it again because my hand will be contaminated and this will all be contaminated. So I'm gonna clean my area. So I'm gonna take one swab, do the outside, throw it away. One swab, do the outside, throw it away. One swab, straight down the middle, throw it away. Now what I'm gonna do, is I'm going to insert my catheter. So I'm holding it open and I got my catheter and I'm going to insert it. And when I'm inserting it, I'm gonna go until I see urine come back. So we're gonna say I got urine right here. So now I'm going to insert just a little bit more. I would do 1 to 2 inches for a woman. Again, just a little bit, but for a male, I would go all the way to the end right here. So we'll do that. Now what we're gonna do is we're gonna let go, let this stabilize the catheter here, and I'm going to inject my water into the balloon. So inject the water in. And I'm gonna let go now, and I'm gonna take this off and throw this away. Throw it away, but we're gonna use it again for later, but we're gonna act like it's a new one. So now that I did that, I'm gonna give it a little tug. So there's a little resistance, so now I'm gonna just put in a little bit more. And after I did that, I'm going to get the stat lock ready. So with my stat lock, grab it right here. This is my stat lock. Open it away from me. Throw this away. Ooh, hey, yeah. I got my stat lock, and I'm gonna point the arrow towards the patient, and to open the stat lock, just push it and then pull up. So now I'm going to put both the port and the rest of the catheter in here, click it in, and then you're gonna take this and put it on the leg up. Take a little bit out. You wouldn't do this. Take a little bit out, and then it's gonna sit on the leg. So we're gonna act like it's sitting there, it's gonna come off. Now that I did that, I'm gonna get the bag ready, whatever. And with this, you're gonna unravel it. You're gonna make sure there's no dependent loops. Make sure there's no dependent loops in there, so urine won't get caught. We're gonna act, this is the bed frame, so you're gonna put it on the bed frame just so it's lower than the bladder. We're gonna do it this way so I can see it. So I got it right here. That's fine. There's no dependent loops and it's on right here. So now that we did that, what I'm going to do is I'm going to show you how to collect a specimen. So I would take off my sterile gloves. Take off my sterile gloves, put it in the trash. Perform hand hygiene. And I'm going to collect a specimen 2 ways, through the port and through the bags. If you want to come over here, Carly. So when I do that, I'm going to to get it out of the bag, place a towel down. Ew, that's gross. Place a towel down and put a graduated cylinder down. And I'm also going to grab my specimen container. So I'm performing hand hygiene, and I'm going to put some gloves on. Still got my goggles on technically. Put my gloves on. All right. So down here, when I do this, I'm gonna look and see how full it is right now. I'm gonna take it down. I'm a little bit closer to the ground, and you pick it up, and you're going to let out just a little bit, and then plug it back up. Make sure not to touch the graduated cylinder. Then you're going to take your specimen. You're going to take this, put the cap up, facing upwards so it's not contaminated, and then you're going to let out a little bit, and then you close it back up. Make sure not to touch the container again. You put this up, and then lock this in, and then you're just going to cap it, and then fill out the label. Now with the port, same thing, gloves and all. You're gonna get a new 10 milliliter low lock, and you're gonna, since it's new, you're gonna kind of give it a little twist, loosen it up, and you're gonna sit down, and then you're going to kink this right here and put this on so it stops the flow into the bag. And open this up, get this ready, and you're gonna put your 10 milliliter lure lock in the port. I already loosened it up, and then you're going to pull out some urine. Let's say 10. This. Then you're gonna put it into your specimen holder. Make sure not to touch the outside again. We're gonna throw this away. Put the cap on. Label. Done. So, after you do all that, and after you put the catheter in, you're gonna throw all your stuff away. So I'm just gonna, well, after that, you take your gloves off, form hand hygiene, and then you're gonna throw all this stuff away. Just gonna put it right here. Your stop line on, whatever. Throw this away as well. And then you're going to reposition the patient, fix their legs, lower them, and then you're gonna document. So when you're documenting, you're writing down a couple things. You're gonna document the size of the catheter. So I have a 12 French, so I would document that. I would document the amount of pee that's coming out. I would document the color and the odor, how the patient tolerated the procedure, and color, odor, procedure, color, odor, the amount. Oh, and if I had to take a specimen, and I would document also the specimen, color, odor, all that stuff. And I would also verbalize, I would do daily catheter care, and I would take out the catheter when there's no need for it anymore. So if they're not on bed rest anymore, or if their mental status goes back up, I'd probably take the catheter out if the person dies, like after palliative care, so that if the condition is no longer there, that's when I'll take it out. So now what I'm going to do is I'm going to take it out. So what I would do, perform hand hygiene, and then put on a pair of clean gloves. Let me unkink this from before. So now, perform hand hygiene, put on a pair of clean gloves, and my goggles. But we're gonna say my goggles are already on, even though it's my glasses, because I cannot see with them both on. So, now again, we're gonna use another, I wouldn't do this. Sorry, oh, it's in here. We're gonna use another syringe, and we're gonna take the water out of the balloon. So we're gonna take it out of the stat lock. Stat lock is still on. So what we're gonna do is we're going to, since it's a new syringe, kind of loosen it up. Then we're gonna do about 0.5 milliliters of air, attach it to the port, holding pressure, and then you're gonna put the air in, and you're gonna stabilize the catheter and let the water come out by gravity. So now we're just gonna wait for that. All right, it's done. So now what I'm gonna do is I'm going to stabilize the patient, take the catheter out, take it it out, and then we're just gonna throw it away. So this is my garbage. Take the stat lock off, throw it away, and then we're going to perform pericare again. So again, soap and water, outside, down the middle, three cloths, and then 3 cloths again for male. 3 swipes going in outward direction around the urethra meatus. Done. I did my pericare. After I do my pericare, again, reposition the patient, put up any side rows. Take off my gloves, perform hand hygiene, and we're gonna document it. So when we're documenting, we have a lot of things to write down. So we're gonna write down the amount of urine that came out after we take it out. Oh, before we take out the catheter, backtrack. Before we take out the catheter, we're gonna empty it first. So when you're emptying it, you're gonna have your gloves on and you're going to just do one of these motions, again, into the graduated cylinder, just so it's empty when you're taking it out. Make sure not to touch anything. And putting it back in, then you're gonna take it out. So then you do the procedure of deflating the balloon and all that. So now, perform hand hygiene, we're documenting. So you're documenting the amount of pee that came out from the graduated cylinder, and then you're also going to document if the catheter was still intact, the odor, color, consistency of the urine, the size of the catheter, and how the patient tolerated it again. And then we're going to teach the signs and symptoms of a UTI. After we do all that, we're going to reposition, wash our hands,